and I'm going to be asking you some medical questions. Do you have any major medical problems that we should know about? I could see your arm. Asthma, high blood pressure, diabetes, seizures.
For Lisa Poisina, this is a great environment to practice nursing. She says she has a lot of autonomy, and her patients for the most part are appreciative of her efforts. In fact, she has held her current position for the past 11 years, and she has no plans to leave.
Left hand in the pocket and get the right hand? I'm not sure. Yes, put your hands in your pockets, walking down the red line for me.
Nurses like Poisina spend 40 hours a week inside the walls of the San Diego Central Jail, and they play a key role in the booking process, which can last anywhere from 6 to 8 hours.
Do you need an extra dose of patience?
Yeah, sometimes. Absolutely.
For a person being booked at the jail, the process begins here at intake, where the soon-to-be inmate is asked a number of questions to make sure they are healthy enough to continue the process.
Any communicable diseases like tuberculosis, hepatitis, HIV? No? Do you have any major medical problems like high blood pressure, diabetes, seizures? Okay.
And asthma.
Poisina's patients are then put in a holding cell before being transferred up to the second floor. There, they receive a more extensive health screening.
Are you currently seeing a physician right now?
No.
Okay, so you said you don't use any street drugs?
No, ma'am.
Have you been tested for HIV?
No, I haven't.
The nurses here in correctional nursing, you have to have good assessment skills. You have to be able to look at them, observe what's going on right away, because you don't have a doctor here 24/7. You have to be able to evaluate, treat them, get them stable so that they can go on to their housing unit.
Nurses who work at the jail handle a little bit of everything. Poisina says that's part of the appeal of jail nursing, and despite the bars and cells, the jail actually has a hospital feel. There is a fully loaded medication room and 2 exam rooms.
If somebody comes in and we need to do a dressing change, or we need to give them a shot, we will pull them in here. We can do the dressing change here. We also have our crash cart here. If we have any emergencies, we will grab the crash cart and we'll head to wherever the emergency is.
Also, there is state-of-the-art digital X-ray equipment used primarily for tuberculosis screenings.
We X-ray all of the inmates to screen them for tuberculosis. We want to make sure nobody's active. And then if we do find a positive X-ray, we will isolate them from the rest of the population.
But here are a couple of big differences. There are sobering cells that feature only a toilet and sink, and then there are the 4 safety cells, used when patients are deemed suicidal or violent.
All it is a place for them to go to the bathroom, a grill on the floor, and we give them a safety garment, and that's how we protect them.
And nurses quickly become familiar with garment suits.
It Velcros at the top here. There's no ties, so they can't tie anything around their neck. It's safe.
While there is a doctor on staff 7 days a week, he or she only works an 8-hour day. So nurses play a much larger part in patient care than at a traditional hospital.
When you're a detention nurse, you're using every skill you've ever learned in nursing school.
Sue Smith is the director of nursing for the San Diego Sheriff's Department. A question she often fields from future nurses: is it safe?
Once in a while, an inmate will be agitated, and I will inform them that I don't treat you that way, and I don't expect to be treated that way, and I'll come back when you calm down. Generally, the nurses are treated pretty good by the inmates. They see us as trying to help them, work with them, and give them what they need. They may get upset when we don't always give them what they want, but generally, I think it's the safest job I've ever had.
The nurses are always accompanied by deputies, and before a nurse is hired, they tour the jail. Retention is good. Some nurses have been here 20+ years.
All right, Asher, here you go. Thank you.
There are 11 nurses on staff at the San Diego Central Jail, which averages between 800 and 850 inmates. The 7 facilities that make up the San Diego prison system house roughly 5,000 inmates/patients. From San Diego, I'm Mark Prescott for NurseTV.